I am Achyut Luitel. I am the board member of Nepal Advisory Board of One Heart Worldwide. During my career in the rural development, the health sector always fascinated me, although I never worked directly. And I knew that One Heart Worldwide was working for the pregnant women and newborn babies. And in Nepal, the maternal mortality rate as well as infant mortality rate, that was alarming. The work that One Heart Worldwide was doing, that really fascinated me, and I was interested when I was asked by the executive director to join One Heart Worldwide as the board member. One Heart Worldwide is not really trying to create a parallel system, but helping the government, the health posts, the hospitals in the rural areas of Nepal to strengthen the system, establishing the birthing center, helping them through training, the skills, the equipments. And when we visit these health posts, having the birthing center and meeting the people, the local people, female community health workers, the nurses, they are very happy with the way they have been supported, and they feel privileged in helping the women. So I was really fascinated when I visited a couple of sites of One Heart Worldwide. Investing in people, creating the organization culture, then investing in the human resources, basically on people and culture. So that is very important for any organization. Innovation doesn't come easily. So sometimes you really try to understand what are the indigenous knowledges in the rural villages. Then you can make a reflection whether that can be done in a different way. You can partner with other different organizations who really work in innovation, mainly the universities. Sometimes even you can provide space for the university graduates to see from a different perspective. Change only by small organizations, that is very difficult. So how we can create synergy? So innovation comes with those kind of interactions, collaborations, more working with the communities. So that is very important. Technology is very important. I mean, any kind of technology, the very simple technology, like even the wheel, because the wheel that makes you easy to carry, some goods from one place to another rather than, carrying on your back. But currently, we have more advancements in terms of information technology. So how you can make use of that? Even we are using different softwares, even the artificial intelligence that is making your life much easier. So we should be adapting with the time. So whatever technology is available, you should understand them and try to make use, so that benefits you as well as the communities. You can be more efficient, you can be more effective. So the importance of technology is very, very high. Community voice is very, very important, because unless we hear them, unless we listen them, then we cannot really help them to find the best solution. So to intervene, you need to have local organizations, or local people, or local leaders who are from the same place, because they understand the place, they understand the people, they understand the problems. So you need to partner with the local organizations, and you need to capacitate them. So that is the only way, you can work in the rural area and having more understanding of the problems in the local context. And I found the similar situation in One Heart as well. While working in the development sector until last year, I was mostly in the small community infrastructures like water system, small irrigations, working with smallholder farmers on agriculture, helping them to understand the issues of climate change, the implications, then how they can overcome it. So those were the sectors I was more busy with. But after joining One Heart Worldwide and after the COVID situation, I understood that health and education, they are the most important. I mean, infrastructures can be fixed immediately, because that attracts the government people, the politicians, the contractors, the elite ones. But the quality of life that basically depends upon the level of education people have and their health, because health is a big investment in Nepal. One Heart Worldwide is really working on very core issues of primary level of health problems, like the pregnant women, how safer deliveries can be done, then how to reduce the infant mortality. So in postnatal phase also, how the baby care should be done, how the women's health should be protected, because they are always working in a drudgery. So immediately after delivery, they cannot really work in the field or elsewhere. So how that balance can be, maintained. So One Heart Worldwide is providing support on that. And during COVID, I thought that, it was a pandemic and many donors will be more attracted towards health governance and health infrastructure. But when I see now, we have already forgotten the pandemic. The investment in health and education, that is still not coming as many of the development practitioners expected. So if you really want to help the poor people in the third world, then obviously more investment should be done in the health and education sector.